this contour now goes right under the pec. There's no more fullness here. And the armpit, you can see, you see the outer border of the pec, and then it dives down in under the pec right there.
This patient underwent gynecomastia surgery by another surgeon about 5 years ago. He had some liposuction, removal of gland. Some revision surgeries are a major reconstruction, but some revisions are just fine carpentry work, and I think this is a great example of fine carpentry work.
What I'll point your attention to is, okay, right now he's got no more bottom heaviness, but he does have this fullness in this under part of his chest that's actually below his pec muscle, and it makes it kind of look irregular because the pec muscle is full here, it goes in and then goes back out. And you can see when I pinch here how thin that is, but when I pinch here, how much thicker that is. And no amount of exercise or losing body fat is gonna fix that because it's just too much stuff here compared to the areas above and below it. Then another area that bothered him is this armpit area. Now this is a very common area for both men and women to have extra fat. And I don't know if it was addressed in the first surgery, but again, when I pinch here, you can see how thick that is versus right there. When you have this discrepancy in thickness, it's gonna stick out. And then that combined with the area that he had his surgery makes this stick out even more. And you can see the shadowing here. My plan of attack for today is to go in through little stealth incisions and do some Vaser liposuction of this entire area on both sides, but mainly focusing on here to create that pec border that is kind of obscured by this fullness, but then also go and get this area thinned down so the transition from the upper to the middle to the lower chest is more fluid. So let me just show you about my markings here, because the markings are very important in these cases. Where I've highlighted his anatomy, this is the border of his pec muscle here. These little hash marks are where he naturally goes inwards, or where there's shadows, and you can see where I've put hash marks on either side. These are the areas I'm going to work at, but then these little plus signs are where they're the most prominent, or where they reach their peak. I would guess if I'm trying to kind of deconstruct why he's even in this situation, I think it's one of two reasons. One, he had the surgery somewhere else and they did lipo and excision. Sometimes I see this and it's usually because they don't go low enough with the surgery and they just stop where the bottom of the pec is. But there's always a little bit of more, and it's usually fat that needs to be carved out to kind of get that transition to the belly. Another thing is that a lot of times people don't appreciate what's going on in the underarm area, and so that becomes more noticeable after the gyno's been treated, because the gyno goes, that area goes in and you start seeing the fullness here. And sometimes even the patients don't recognize that when they're so focused on the gyno. Plenty of times I've been in a consult where I mentioned this and they're like, oh, I never even noticed that I had that. And I'm said, you will notice after the surgery. So here we are in the operating room, he's laying down. Let me just show you what I wanted to demonstrate when he was standing. You see the pinch test here versus here. And so when you have this, it's gonna make this look a lot thicker and almost like he's got a roll of tissue or fat underneath his chest. I'm gonna inject a little bit of tumescent fluid into these areas, let it sit, and then go in with the Vaser to break that all down and melt the fat, and then suction that fat out to start to contour these areas. The Vaser is basically this probe that I'm using that emits these ultrasound waves really quickly, and it helps to shatter the fat cells. And I think in revision cases especially, the Vaser is an indispensable tool, because not only is there some extra fat here, but there's going to be some scar tissue that this Vaser can break through pretty efficiently. Much easier than if I just had a liposuction cannula. So I always love doing this with the Vaser. I've been using it for over a decade to really break down this fat, but also the scar tissue in and around the fat, so I can get much more precise lipocontouring. And so I'm just kind of feeling it, and it's kind of, I can feel it get stuck on tissue and then push through. Gets stuck and then pushes through. And so yeah, it's a really helpful tool, but like they say, a tool is only as good as the person using it. So here's a case update. I finished on the left side and I haven't done the right side yet. And you can see already, like when I push down here, this contour now goes right under the pec. There's no more fullness here. And the armpit, you can see, you see the outer bore of the pec and then it dives down in under the pec right there. But again, the pinch test, right? I still do the pinch test here and then here. You see how thin this is now compared to here, right? So you can already see this is much better contoured underneath his pec. So you can see this versus this. So this patient came to me for revision gynecomastia surgery because he was still unhappy with certain areas of his chest that were full. He's sitting about 80, 85 degrees, and you can see before he had a lot of fullness here and here that kind of didn't make sense with the rest of his flatness, but now you can see when I push down on the pec, this contours nicely in. And with these cases, there's always a little bit of swelling that happens, but he's gonna have a really nice result. I know that because one, the pinch test is super thin now. It's the same now as his nipple. Number two, I got almost half a liter out, 250 cc's of fat, but not just in the pec area, but also in this armpit, which bothered him. You can see now that pinch is really nice compared to the before, and it matches everything around it. And I feathered it down to this area that was a little bit indented from his prior surgery, so it should be a much smoother transition. And again, on this side, you can see too, he's got a very thin pinch test now, much more in line with his nipple area. And so that fullness that he had, that roll, is not there anymore. And it did a little bit in the armpit as well. Again, that pinch test, very good, nice and even. It's going to be really important for, in these cases, what I do is I put these foam pads on to start training that skin to take onto the muscle where I hollowed it out. And so he'll be in these foam pads for about a week or so, and then just a straight compression garment. But he's gonna do great, gonna get him in the recovery room. Until next time, guys.